Hello, we have Dr. Camille from Germany. He is an PhD doctorate in biochemistry and microbiology. So we had a summit in wheat related disorder. So we would like to ask some questions to Dr. Camille. Sir, uh, what do you think that food allergy create and play a role in developing some kind of chronic disease?
Yes, absolutely. So everything we eat will have an impact on our body, and if our body is reacting, was fighting against that particular food, in particular with IgG antibodies, it will induce a chronic inflammatory response in our body. So if this happens to a food that we eat on a regular basis, this pro-inflammatory progress goes on, and at the end it will lead to plenty of different types of chronic diseases, starting with metabolic diseases like obesity or diabetes. Can be migraine, can be joint pains, can be gut problems, can be anything, can be autoimmune diseases.
So normally in India we are doing a IgE type of food allergy test. So what is difference between IgE? So we should check IgG or conventional IgE test.
IgE tests are very, very good for immediate allergy. So that means that you bite into an apple, and within seconds or half a minute, your mucosa is swelling or your skin is itching. Then you have to go for an IgE test. But IgG is something you will not feel immediately. So IgG will lead to a delayed type of allergy. So you eat something now, and maybe the symptoms will appear as earliest as 3 hours, or even up to 3 days. So it's practically impossible for an individual to identify a food which is reacting by IgG. So therefore, if you have a chronic problem, not an acute problem, a chronic problem, you need to go for an IgG test.
So how could we find out IgG test?
Well, fortunately, in India now we have the availability to test for IgG testing with a test called ImuPro. So ImuPro is a worldwide distributed test that specifically tests for IgG against up to 270 food. So that means that more or less 99% of what you are supposed to eat can be tested and can be identified as a trigger for inflammation.
Yeah, so thank you very much.
Thank you.
Yeah.